Hello, good morning everyone. So my name is Wilbert Gallarde together with my group mates, Shaina May Antonio, Nicole Alam, John Aaron Agorilla, Mary Genesis Dungka. So our topic for today is improving healthcare quality and patient outcomes through the integration of evidence-based practice and informatics. So what is EBP first, or the evidence-based practice? At bakit siya importante for you as a health professional to know this skill, whether you're practicing here in the Philippines or in another country. So ano nga ba itong EBP na ito? EBP stands for the evidence-based practice in other professions. This is also called evidence-based healthcare or the evidence-based medicine. So ngayon, ano nga ba yung definition ng EBP na ito at bakit parang ang dami-daming sinasabi na dapat nag-EBP ka? Ano nga ba itong EBP na ito? So according dito sa babasahin ko, so EBP stands for the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of the individual patient. Ang ibig sabihin po nito ay ginagamit nyo ang ating current na mga research papers, the current published papers, para integrate kung ano yung best na treatment or assessment na ginagawa natin para sa ating clinical patients. So basically, mayroong tatlong parts kasi yung EBP, kailangan na na-integrate mo yon. Unang-una is your professional experience, your clinical experience, what you found works for your patient, for your setting. So, dapat yon na-integrate mo yon at yung pangalawa naman ay yung current evidence. So, these are the research published, the current evidence that are used in practice. Kung ano yung nagwo-work, and yung third one is the patient preference. So, ano nga ba yung gumagana para sa pasyente? Ano nga ba yung afford ng pasyente? Ano yung choice na gustong gawin ng pasyente mo? So, you have to consider all those three things when you're thinking about the best treatment, the best intervention na ginagawa mo para sa pasyente mo. So, yung part talaga na tinuturo sa mga different schools na hindi tinuturo before, paano ba gumawa yung EBP. Specifically, yung current evidence na part nun, basically you're doing there is you are being or tinuturo ito paano maghanap ng iba't ibang research papers, paano pumili kung ano yung applicable sa setting mo, at paano i-criticize yung paper kung ito ba ay good, maganda ba yung methodology niya, wala ba siyang biases or kakaunti lang yung biases niya, and how this applies in your practice. So actually, sa ibang bansa kasi, yung evidence-based practice is actually very well developed. Pero dito sa Pilipinas, hindi pa siya ganun ka well-practiced. Hindi pa ganun kadami yung marunong ding gumawa ng EBP. So it's a relatively new practice here in our country, in the field of healthcare. And actually, the reason why na hindi masyadong napapractice yung evidence-based practice dito sa Pilipinas is because unang-una, there are very limited people who know how to do it. There are very limited health professionals who are actually trained to do the evidence-based practice. At syempre, kung meron man mga marunong, madami sa kanila pumupunta din ng abroad or the academe to work there. Yung pangalawang reason why EBP is not practiced here in this country is because it is very time-consuming. Syempre, maghahanap ka pa ng iba't ibang research paper on the top of the clinical practice, giving actual to the individual patient, so talagang time-consuming siya. So, yung mga clinicians nga, parang wag na lang, wala nang oras, wala nang akong pahinga, gagawin ko pa yon. Mga ganun nga mga rasunan ng ating mga clinicians. Yung pangatlong reason is because you need to have a good grasp of research for you to actually perform EBP very well. So you have to understand ano yung mga iba't ibang research designs, ano yung mga iba't ibang statistical tools na ginagamit. So paano yung mga iba't ibang sampling na ginagamit sa mga research papers pag nakikita mo kung gaano kaganda yung paggawa ng isang research paper at paano ito mag-a-apply sa setting mo. So it doesn't mean na hindi na dapat natin ginagawa yung evidence-based practice because of these reasons. Siyempre, we need to always strive to improve the practice. Kung ano yung tinuturo 20 years ago, our practice has to evolve with the times. It was to evolve on what is known, kung ano talaga yung nagwo-work, kasi in the end, We are here to serve our patients kasi wala naman tayong profession in the first place kung wala yung mga pasyente natin. So for me, ano nga ba yung reason kung bakit dapat ikaw as a health professional dapat marunong kang mag-EBP? So the first reason is because you need to know what is works and what is doesn't work. Yung ating practice kasi, hindi naman kasi all the time that what is being taught theoretically or has a theoretical backing, it doesn't automatically translate that it will be effective for your patient. So that it is automatically okay to use that certain assessment tool, kaya kailangan gumagana ang EBP para malaman natin ano nga ba talaga yung mas gumagana. So which intervention is really more effective works for this kind of population for our patients. Kaya dapat alam mo kung paano mag-EBP. So the second reason is because your patient deserve to be treated. Andito ka para pagalingin yung pasyente mo. They are there, they are giving their money, their time, their efforts because they are hopeful that you will help to improve their quality of life, their condition. So and the third reason why we should know how to do the EBP is for autonomy. So if we want to be able to push autonomy here in the Philippines, we have to show to our politicians, the people in power, our patients, people in our community, in the scientific community, that we are actually very, very good, that we know how to do the things, the evidence-based practice. We have the 7 steps of evidence-based practice. So let's start with the step 1, well-ordered clinical question. So the very first thing you need to do is a clinical question. So, but before you can have a clinical question, you need to have a triggers or practice question. Triggers, according to the Iowa model, would be like problem. So to formulate a clinical question, you can be guided by a PICO. Clinical question should be incorporate at least 3 these elements. So these are 4. But if you have 3 of these, that's good. Sometimes they add a T, which is time-bound. So P means patient, I is intervention, C is comparison intervention, and O is outcome. So for example, the patient, so in when you make a reason, evidence-based practice, you can cover everything. You have to be able to define the parameters in terms of the characteristics of the patient that you want. For example, you are talking about the pediatric patients, elderly patients, what age or adults, the sexuality, ethnicity. You have to define, is it the diabetic patients, is it the cancer patients, or what other conditions, or general health status. And then you talk about the intervention. What are the intervention and therapies that you're interested in? Could be a patient education, a diagnostic or treatment plan, self-care, or what other things that you wanted to do and bring and to understand. So C is comparison intervention. Sometimes this is present, sometimes it's not a comparison, could be another subgroup, a control, or a different study group. So O is the outcome expected or actual effects on the patient. So the second step is the acquire research evidence. The type of question you ask to determine the level of the evidence of study design that you need to define. Effective searching takes time, practice, and an understanding on how different databases are structured and best utilized. And then you need to appraise the evidence. How to do, there are so many ways, and you can read more in the handout. So basically, you're looking at the quality, the magnitude, quantity, consistency, and applicability of those steps, and then you apply the evidence. And then the last, step 5, is to assess outcomes of the practice change. Outcome measures reflect the impact of the patient and identifies the end result of your improvement. We have the barriers and facilitators of evidence-based practice. The barriers and facilitators of the EBP in clinical setting include having staff who have been trained in EBP and have the resources available to evaluate the evidence in a time-efficient and cost-effective manner. Easy to assess to evidence leadership, endorsement, and management support of EBP, so having someone of the team who encourages the practitioners to use EBP. Consume such as yourself, having an understanding of everything principles and an awareness of specific treatments creating demand for the EBP, some barriers of EBP. So including dito, kasali dito yung barriers ng facilitators of evidence-based practice is having a staff who do not understand or not trained in EBP, also not have an ability to evaluate and appraise research or have confidence in the value of research and implementing change. Researchers can also be conflicting and confusing. So which makes in harder staff who are not confident in conducting EBP, they may not have a lack of access to evidence resources, which prevents the practitioners from being able to incorporate the evidence into a clinical decision. So they may not be able to cost or purchasing EBP materials and the cost of training. They may not have the time required for the training and implementation into practice. Cultivating a culture that supports sustains evidence-based practice. So in order to cultivate a culture or to create a culture evidence-based practice care, it is essential that leaders review measures of whether the practice has impact, made the changes needed to align care with new evidence, and whether those changes are having the effective effects of a patient outcomes. So paano natin lilinangin ang isang company culture? First, we need to respect the individual, positive environment, and clear end goals, and provide regular encouragement.
The role of technology in supporting evidence-based practice. In technology tools in clinical practice, nurses, nurse practitioners, and healthcare providers today are very cognizant. It means they are being aware sa pag-push for cost containment, pag-improve ng safety ng pasyente, pag-improve rin sa quality of care, at pag-reduce ng variation of care, hindi lang sa ibang bansa, kundi sa buong mundo. So people nowadays observe na merong pagbabago sa healthcare choices and dito nakabatay ito sa quality and outcomes, hindi sa magiging kung ano or magkano yung halaga or kapalit ng kalidad ng serbisyo. Information technology brought to healthcare a compendium of new tools which supports EBP. So dito, they say it brought compendium kasi nga we talk about IT, so it means it collect concise but detailed information systematically. As a consequence, IT not just improve. Alam naman natin na technology is dynamic, so habang patagal ng patagal, mas nag-e-evolve at nag-i-improve ito. Also, it becomes complicated to many currently existing processes. The goal of informatics in technology tools in clinical practice is to use technology to bring critical and essential information to the point of care para ma-increase yung efficiency in terms of giving care sa pasyente and to provide safer and more effective healthcare system, and most importantly, yung binanggit ko kanina, to improve quality and outcomes. And according to Anderson and Wilson, 2008, Benoliel, 1996, Gleiser, 1978, despite the advancement in information technology, the most effective evidence-based care remains evasive for nurses. Okay, for competencies, ang mga nursing professionals is nagre-range sa age from early 20s to their 60s, with the average age of a registered nurse today in their early 50s. So in this range, meron itong significant in terms of their learning skills and comfort sa technology and evidence-based practice. So ang mga nursing students ngayon like us ay napakadalubhasa or techie in terms sa paggamit ng different gadgets. like iPads, mobile phones, laptops, ganon. And alam naman natin na kabilang tayo sa Generation Z, which means we grew up with technology. And according to National League of Nurses, they conduct a study. They conducted the study noong 2006, and according sa study na to, 60% of nursing programs had a computer literacy requirement, 40% had an information literacy requirement, and less than 15 naman sa respondents nito, it stated informatics was integrated into the curriculum and experience with information systems provided during the clinical experiences. As an outcome ng study ng NLN, they publish a statement na naglalayong ang mga nursing schools ay nire-recommend na i-require lahat ng mga nursing students na graduate silang may kaalaman at kasanayan or skills sa 3 critical areas, and which are the computer literacy, the information literacy, and the informatics. And according to Pravikov, Tanner, and Pierce, they stated that nurses use experientially acquired information from interactions greater than scientific evidence from medical and research journals. So they found out na nurses acquired from interactions sa kanilang mga peers, patients, colleagues, and physicians. And itong situation na to ay nag-exist pa rin hanggang ngayon. Napaka-imperative nito sa mga nurses in engaging the said skills na nire-require ng EBP. If we talk about imperative, it should be absolutely necessary or required. So, preparing undergraduate nursing students in EBP and the use of proper technology has significance for advancing EBP in nursing. According to Rush 2008, the preparation of undergraduate nursing students for using evidence to guide practice is no longer optional. EBP is imperative for nurses para ma-ensure yung quality, cost-effective safe care, and it provides more predictable outcomes para sa mga healthcare consumers. Okay, for the decision support and evidence-based practice, for the decision support system, the decision support system or the DSS are automated tools designed to support decision-making activities and improve the decision-making process and decision outcomes. Such as systems are intended to use the enormous amounts of data that exist in information system to facilitate decision process. That is according to Androwitz and Kraft 2011. So, ang DSS, ito ay isang computer program na ginagamit para ma-improve yung decision-making capabilities. So, ina-analyze nito yung mga large amount ng data within EHR na present, and ito yung mga pwedeng maging possible options na maaari ating gamitin. So, ginagamit ito sa field natin in connecting evidences with patient status. Clinical Decision Support System or the CDSS. These are systems designed to support healthcare providers in making decisions about delivery and management of patient care. So, ang CDSS, ito naman is nagpro-provide ng mga information na timely and usually at the point of care to help na ma-inform about sa decision in patient's care. And it aims rin to provide prompts and reminders to assist healthcare providers in implementing evidence-based clinical guidelines at the point of care. So, ang example nito ay CDSS help clinical teams by taking over some routine tasks, warning potential problems, or it also provides suggestions para sa clinical team and patient na pwedeng i-consider. And according to Androwitz and Kraft, 2011, they have the potential to improve the patient safety and outcomes for specific patient populations, as well as compliance with clinical guidance and standards of practice and regulatory requirements. For the evidence-based adaptive clinical decision support system, this system designed with multiple rules and access to multiple databases for information. According to Sims et al. 2001, they are complex systems and contain mechanisms to incorporate new findings and evidence. The evidence-based adaptive clinical decision support system are proposed based on current evidence na meron, and it also have the mechanism for routine updating and recommendations sa mga new research findings. This system includes the integration of best available evidence, and these are clinical expertise, the patient values, and the circumstances related to patient and client management, and lastly, the practice management and healthy policy decision making. These three elements are equally important. And for the standardization of terminology and data, clinical terminology is a factor which plays a significant role in increasing the availability of evidence at the point of care. Clinical terminologies have not matured to a level to be used in clinical information system or the CIS. Standardized clinical terminology is necessary for evidence to be both computable and interoperable with multiple systems. And ibig sabihin nito, this terminology are able to exchange and make use of the information. The next step is to facilitate EBP by increasing the transparency to the healthcare provider. To be efficient, the evidence for EBP must be incorporated into the everyday workflows and care processes na ginagamit ng mga nurses at ibang healthcare providers. The data must be integrated with clinical systems na ginagamit ng mga providers to provide readily accessible EB knowledge for the end user or at the point of care kung kinakailangan. To be successful naman, it is essential to link evidence to assessment results, documentations, orders, and plans of care. According to Gagerty 2006, it's in these forms: plan of care, order sets, standardized rules and alerts, and the like that evidence will finally be widely, consistently, and reliably used at the point of care. So, standardized nursing terminology is required for quantifiable and retrievable data. It also allows for coding of nursing practice in the EHR. IT system document and code nursing practice, aggregate and compare coded data across client settings, population, and time and development core databases for data mining and meta-analysis. Terminology is required for compliance with regulatory and payer requirements. Example, um, examples of nursing qualifications used today are listed in table, which will be explained by the next reporter. For the criteria for standardized nursing terminology, Simino, Ripsack, Johnson, and Clayton 1989, they identified this criteria for the design of a controlled healthcare vocabulary. So meron tayong 7 criteria dito, and this criteria includes domain completeness, unambiguous terms, non-redundancy, synonyms, multiple classifications of term, consistency of use, explicit relationships. And meron rin tayong other criteria which include designed for a computer-based system and developed from evidence-based practice. And that's my part. The next topic will be discussed by the next reporter.
Identification of common data and definitions. It is not uncommon for different departments, hospitals, and systems to have different definitions of the same data elements. Unless everyone is using the same set of data definitions, there will be errors in data collection, analysis, and conclusions. So, ang common data element is a standardized, precisely defined question that is paired with a set of specific allowable responses na ginagamit natin systematically across different departments and hospitals. This is to ensure consistent data collection. They are generally structured as a precisely defined question and answer, with the answer having a specified format or set of permissible values. Example nito is yung demographic data. Pag magkaiba kasi ng system yung ginagamit ng iba't ibang hospital para sa pag-collect ng data, may chances na magkaroon ng problem sa pag-endorse ng isang patient. Kasi nga, magkaiba sila ng system na ginagamit. So, magkakos talaga ito ng incompatibility. Next naman is tools for managing clinical data. Many software tools are available for data management, and these are called Clinical Data Management System or CDMS. CDMS has become essential to handle huge amount of data. According sa isang research, Excel, Access, and Google Form rank among the most used data capture tools in healthcare. Google Forms make it especially easy to collect information directly from patients since it can be sent out as a survey and enables collaboration on ECRF designs with other researchers. And both Excel and Access allow you to import or directly link to data stored in another applications and databases. Data quality. If healthcare authorities want to maintain and improve healthcare at an optimal level, they need to ensure adherence to data quality standards. So, nade-determine ang data quality based sa iba't ibang standards. So, ito yung mga 5 standards. The first one is accuracy and validity. Dito, an original data source is not misleading or corrupt. Next is reliability and consistency. Dito naman, information follows a set of standard throughout the organization. Dito, kung ano dapat yung in-input mo sa isang system na information about sa patient, dapat ganun din yung lalabas sa ibang record ng patient. Next is completeness. All required data fields are present. Dito naman, dapat sa record ng patient, sa system, dapat naka-input na yung mga nursing notes, nursing plans, progress notes, or yung mga NCP, and yung iba pang data na kailangan sa health record. Next is currency and timeless. Dito, kailangan yung data is up to date. Parang mag-i-start sa admission yung pag-input ng mga information about the system, and dapat yung data na naka-input is already checked and verified. The last standards is accessibility. Data is available to authorized persons as when needed. In an electronic patient record system, clinical information is readily available when needed. System selection issues. Clinicians should participate in the selection process for clinical information system and consider data requirements during the selection process. When we say kasi na consider data requirements, dito ano ba dapat yung mga information na kailangan i-input sa clinical information system. And after gathering yung mga information, kailangan i-evaluate ng mga clinicians yung information na in-input nila sa system. Next is, they should consider the quality and availability of data for use on the back end to facilitate other uses of routinely collected health data. So, doon naman sa mga data na na-collect, hindi lang basta-basta na i-input yun sa system. Kailangan din na after ma-input, kailangan siyang ma-integrate and magamit siya for improvement ng CIS or Clinical Information System. Because underestimating the importance of data management can hinder the data quality, impair research results, misinformation of clinical practice, or generate invalid hypotheses for new clinical trials. Consideration for successful CDSS. Nabanggit ni Ms. Duncan na ang CDSS or Clinical Decision System ang tumutulong sa mga healthcare workers with their decision-making when it comes to patient care. It is mentioned in the provided module that Brine and Lang examine nursing data elements from evidence-based recommendation for clinical decision support. Because of their study, nalaman nila na CDSS can allow multiple data sources to be analyzed, but hindi nito na-address yung practical implications of redundancy, ambiguity, and lack of conceptual clarity identified in data sources. Kaya nga ni-recommend nila na we nurses and other healthcare workers to capitalize on data elements with high data availability. Ibig sabihin, gamitin lang natin yung mga relevant data ng patient to determine their diagnosis and treatment plans. Another element na ni-recommend nila is to promote the use of integration of standardized nursing terminologies. Ano nga ba yung standardized nursing terminologies? Ito yung nakakatulong para magkaroon ng better communication ang mga nurses and other healthcare providers. In using CDSS kasi, dapat pare-pareho ng terms yung ini-input ng mga healthcare providers kasi pag hindi sila magkakapareho ng ini-input, maaaring magkaroon dito ng ambiguity or redundancy. One of the reason din is one of the reason kaya kailangan iisa lang yung term na ini-input para hindi mahirapan yung system na i-process or interpret yung data na nakalagay na sa system. CTIG identified 5 elements as prerequisites for a clinical real-time point-of-care clinical decision support system. This includes integrated real-time patient database. Dito, the database must be able to integrate data under a common patient identified. Ibig sabihin, pag sinearch mo sa system ng hospital, yung name ng patient, the system must show all the data of the patient such as personal information and medical history. Next is data-drive mechanism. A data-drive mechanisms enable a flag or trigger to be set so that a program can be activated when a particular type of data or data item is stored in the database. When we say kasi na data-driven mechanism, ito yung nag-aalaw ng execution of any instruction based doon sa data na naka-input sa system. These triggered events allow for the system to be automatic, real-time, and asynchronous. Next is knowledge engineer. Ito yung mga informatics expert na responsible sa extracting and translating ng clinical knowledge into machine executable logic. Next naman is time drive mechanism. This allows for programs to be executed automatically at a specific time in the future or after a specific interval has passed. Ang time drive mechanism ay ginagamit to remind clinicians to perform specific activities or to check that the appropriate action has been performed. Example nito is input nila sa system yung time na kailangan nila ibigay medication tapos magbibigay ng alert yung system if ever matapos na yung medication. Last is long-term clinical data repository. A long-term clinical data repository contains the patient-specific data from a variety of clinical sources collected over a period of several years. Tinutulungan ng clinical data repository ang mga nurses and other healthcare workers to gain more comprehensive understanding of patients' medical history, which helps improve the healthcare of the patient. The functions of clinical decision support systems include alerting, reminding, critiquing, interpreting, predicting, diagnosing, interpreting, image recognition, assisting, and suggesting. The scope of functions provided by clinical decision system is vast, pero ang main function nito is to help healthcare providers make decisions and improve their patient care. DSS are passive or active. DSS is also called Decision Support System. Nabanggit ni Ms. Dungka kanina na ang DSS ay isang computer program na ginagamit para ma-improve ang decision-making capabilities ng doctors and nurses. May dalawa itong system. The first one is passive system and yung isa naman is active system. So, ang passive system, it would notify an individual of an event such as an abnormal finding. Ang active system naman will offer suggestions or take actions such as place a specific order when specific criteria are met. DSS always allow for the provider to have the options to ignore the alert, override the alert, or inactivate the alert. Always remember na yung clinicians pa rin yung gagawa ng final decision. Clinical decision support systems allows for optimization of both the efficiency and effectiveness with which clinical decisions are made and care is delivered. The cost of clinical decision support systems can be high. According sa isang survey, a registry-based CDSS was about $9 for small, $20 for medium, and $76 for large. However, kahit ganun kalaki yung presyo ng CDSS, the savings occur in the improved decision-making at the bedside and improved quality and outcomes. And it also helps in reduction of errors. What can outside reference sources or vendors bring to the table? The tools for evidence-based practice have evolved from paper and pencil to evidence-based practice embedded in the clinical information systems via links and decision support systems at the point of care, with the vendors maintaining the responsibility for reviewing the research and presenting the best practices to the facilities. The information can be incorporated onto the bedside care in a more expeditious manner. So una, ano nga ba yung vendor when it comes to healthcare? Ang vendor, this is the person or entity engaged in the business of developing, marketing, or supporting information system similar in function to the software. Sabi kanina, ang vendor yung yung responsible sa pagre-research dahil ito yung nagpro-provide ng reliable services. The representative or the hospital representative must ask about the quality of the clinical information system kasi nga, CIS is very crucial in making decisions in diagnosing or making a treatment plan for the patient. Kaya kailangan talaga na malaman or maintindihan natin yung quality and effectiveness ng isang CIS.
So, thank you, Nicole. Now we're going to move on in integration of EBB technology in the clinical area. So, why EBB important in clinical area? Because using EBB in clinical settings requires a working knowledge of research terms and methods. It allows nurses to implement the latest research methods in real-world scenarios like direct patient care. Melnick 2013 states, although progress has been made over the years, the same barriers to EBB identified decades ago. Example, time, lack of knowledge and skills, peer resistance, lack of access to resources, and EBB mentors continue to exist to healthcare system. So next, information access. There are over 150,000 medical articles published each month, Matter 2016. Dito sa table 40.5 provides several examples along with their web addresses of sources for EBB available today. Most are free, however, some sites do have subscription fee. So, hindi ko na siya babasahin isa-isa pero ang nilalaman lang nito ay about sources for journals and bibliographic database. So next is data, information, knowledge, wisdom, healthcare business, intelligence. Worsley 2000 defines the data as the raw material from which information is generated and information is the relevant, usable commodity needed by the end user. Information is born when data are interpreted, Bailon 2010. So meaning, nag-i-start yan lahat sa data. Tsaka lang yan nagiging information kapag mayroon ng interpretation yung data. In order for information to be useful, it needs to be accurate, timely, complete, concise, and relevant. First is accurate or accuracy. Accuracy is to be ensuring that the information is correct and without any mistake.
Accuracy is important because may the life of people depend in it, like the medical information at the hospitals, so the information must be accurate. Next is timely. Information should be communicated in the time so that receiver of the information has enough time to decide appropriate actions based on the information received. So next is complete. Accuracy of information is just not enough. It should be also complete, which means facts and figures should not be missing or concealed. Concise means communicating complete information about a topic or idea in a few words. Concise also involves being mindful of word choice. So lastly is relevant. Information should be communicated to the right person. It means person which has some control over decisions expected to come up from obtaining the information. Engelbart and Nelson 2002 explained the Nelson data to wisdom continuum. Data is provided, data generate information, information generates knowledge, integration and understanding of knowledge leads to wisdom. So meaning, yung data kasi as is lang yun. But if binigyan ng interpretation yung data, dun siya magiging information. Tapos syempre, since meron ng information, ma-generate ng knowledge. Dahil sa information na nabuo from the data, therefore, meron ng knowledge. Tapos pag nagsama-sama na yung interpretation, understanding of knowledge, maglilid naman siya sa wisdom. So next, here are the 5 dimensions of data. So first is completeness. Complete referred to whether or not truth about a patient present in the EHR. Next is correctness. EHR data were considered correct when the information they contained was true. Other terms that were commonly used to describe this concept include accuracy, error, and quality. Occasionally, correctness included completeness, due to the fact that some researchers consider missing data to be incorrect. Concordance. Data were considered concordance when there was agreement or compatibility between data elements. This may mean that 2 elements recording the same information for a single patient have the same value, or that elements recording different information have values that make sense when considered together. Possibility. Data were possible if they were in agreement with general medical knowledge or information and were therefore feasible. In other words, assessments of possibility were intended to determine whether or not data could be trusted or if they were of suspect quality. Lastly is accuracy. Data were considered current if they were recorded in the EHR within a reasonable period of time following measurement, or alternatively if they were representative of the patient's state at the desired time of interest. This table describes the 5 common dimensions of data quality. So under completeness, there is accessibility, accuracy, availability, missingness, and omission. So next in correctness, there is accuracy, correction made, errors, misleading, positive predictive value, quality, and validity. So under concordance, there is agreement, consistency, reliability, and variation. So next under possibility, there is accuracy, believability, trustworthiness, and validity. Lastly, in accuracy, there is recency and timeline. So that's it for my part. May I call John Aaron?
Okay, thank you, Ms. China May, Antonio. Now we're going to talk about the idea that technology is only a tool for evidence-based practice. Okay? So sabi sa research ni Anderson and Wilson noong 2008, by the way, I'm sorry if I cannot properly cite them because all of the researches na nakita ko is wala silang first name. So ayun, they found out that there are only few studies na ginagamit ang CDSS as one of the parameters for promoting evidence-based practice. In the research, they found out that the nursing practice is lagging. It's behind in the process of modernization. But you have to remember that the context of their research is nasa United States, and this research actually helped for their government to mandate federal incentives, which basically means funding in healthcare. Sabi ng government, popondohan namin ang hospitals para maging widespread ang gamit ng CDSS. But for that to happen, there must be a condition. Kailangan i-prove muna na ang paggamit ng CDSS is magre-result na improvement sa quality ng healthcare. And syempre, may promote nito yung evidence-based practice. Now, if you think about it, what was nursing practice like before the conception of evidence-based practice, di ba? Ang mga nurses nagre-rely sa, number one, taking advice from nurse supervisors and managers. Of course, it's natural to ask your superiors because they have better scope on work experience and certainly, mas marami silang alam. But then again, if you just take advice from people and you don't apply critical thinking into what you're doing, hindi siya progressive. Hindi ka lang tanggap ng tanggap dapat. You also need to be curious. And for this to happen in a workplace, kailangan lahat kayo may motivation para i-inculturate sa inyong staff or organization yung vision for better care. Next is yung carrying out approaches based on what was traditionally done. Again, it's simple as saying outdated na yung practice na ginagawa sa isang hospital. And you have to remember that the healthcare is science. And ang nature ng science is to develop, to innovate, and what may be universally accepted na ginagawa in the present sa practice ng nursing can be replaced with a better solution in the future. Okay? Third one is using personal experiences confirmed by what worked with patients in the past. Of course, personal experiences can be a great teacher. Sabihin na lang natin. But then again, it may be also a subjective and isolated phenomena or experience, meaning what may work with this patient may not work to the others. Maaring gumana sa pasyente mo ngayon, maaring hindi. But it should be emphasized that different patient cases have different factors at play sa kalagayan nila. Kailangan standardize ang care na ibibigay mo. Next is applying knowledge from nursing education that could become outdated, of course. It's the same with the second one na sinabi ko kanina, ang nursing practice goes into continuous development. And kung ano yung pinag-aralan natin ngayon, maaaring i-revise pa ng i-revise for the next generation of nursing students kasi may bagong findings. That is the idea of evidence-based practice. Okay, for the next slide, let's talk about the 12 characteristics of successful clinical decision support systems. First one, incorporate into existing systems. Of course, the clinical decision support system should be readily incorporated in the organization. In a hospital setting, yung CDSS na mailalatag na gagamitin ng healthcare providers is naka-standard na sa buong workplace nyo kasi ang goal ng CDSS is to have a uniform system of diagnostic support. Next is integrate into the current workflow. Now, this elaborates yung una kong in-explain. The first one, the emphasis on this part, is the idea that when you implement a CDSS in the hospital, kailangan naka-integrate na yung purpose ng CDSS sa trabaho mismo ng healthcare providers, sa nurses, sa doctors, di ba? The first step is ipasok sa system, as I have said, yung CDSS. Ngayon, ang challenge is paano mo may integrate yung CDSS sa mga hands-on na gagamit nun mismo. Okay, and how will they be able to work around it as a network of individuals? Siyempre, you have to consider din. Next is provide a specificity. The intention itself of CDSS or clinical decision support system is to guide clinicians. Of course, along with that is to lessen the uncertainties in making a clinical decision. Next is incorporate user involvement. Siyempre, kailangan mo ng interaction mechanism sa CDSS to input data or patient information. Hindi ka niya mag-guide unless you put all the necessary information to come up with a possible management technique, diagnosis, drug interactions, alerts, etc. Okay? Provide education and training. This responsibility is nakasalalay mainly sa admin ng isang workplace. Of course, bibili ka ng software and devices ng isang CDSS mula sa isang vendor, papunta sa isang hospital, may adjustment na mangyayari. May technical know-hows kung paano yun mag-work to maximize the use of CDSS. The proper use, potential uses should be clearly informed to and be learned by the clinicians that will be using it. Okay? Next is provide sufficient system support. Ngayon naman, if you want to continue having the convenience of using CDSS, you should provide system support. Ngayon, papaano? Of course, the CDSS should always be updated. Dito pumapasok yung concept of evidence-based practice. Laging may new findings na pwedeng i-apply. Also, regular checks ng system para makita yung problema or kung may problema man. Syempre, you are dealing with human life. Hindi pwedeng basta-basta yan. Okay, next is provide automated system prompts. Ito yung mga automated pop-ups na when there is an emergency case, merong pinapop up na parang programmed na conversation or dialogue na pinapakita sa screen na dati nang nakalagay. Okay? Next is provide straightforward alerts. With regards ito sa automated system prompts, kailangan specific yung information na binibigay ng alert. Hindi pwedeng generalize ang alert. May coding and more to that, nakaspecify in text kung para saan yung alert. Okay? Next is have simple clinical decision support system displays. Of course, having too many display variables sa isang screen is nakaka-frustrate and nakakawalang focus sa clinician users. Okay? Next is prompt acknowledgement. Ito din related din to sa alerts, nakaka-explain ko lang. But the focus is the reaction of the CDSS, kung paano siya kaagap sa mga alerts. That's why successful CDSS also relies on the prompt acknowledgement of task that is being assigned on the system itself. Require minimal clinical decision support system data entry because ang mga gumagamit ng CDSS sa isang hospital would undergo training, and part of this training is to learn the concept of uniform coded technologies. Terminologies rather. Kailangan may sistema, may specific na words or data lang na pwede mong i-input sa CDSS para efficient ang processing. Kasi kapag hindi uniform ang data entry sa isang CDSS, mahihirapan mag-process, ang dami rin nasasayang na time. Right? Lastly, have continuous clinical decision support system evaluation and monitoring. Just like everything, wala namang perfect, diba? But through system evaluation and monitoring, ma-maintain mo yung functioning ng CDSS and more importantly, may improve for better quality of care. Okay, I think that's the end of our presentation. Hopefully, you learned something from this discussion. Thank you for listening and goodbye.